Navicular stress fractures are by no means the most common stress fractures of the foot, but they do occur in running and jumping athletes. In this video, I answer the question from a viewer about why her injury is taking so long to heal and what treatments are often needed for these injuries. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Now, you may not know what a navicular stress fracture is. This is a bone in the arch of the foot. If you're looking at a model of the foot from the top and then you look on the inside of the foot in the sort of the top of the arch, there's a big bone right there called the navicular. And it is subject to a lot of stress, especially with running sports. So you see it in cross-country athletes, you see it in track and field, sometimes in marathon runners, even though in my patient population over my career, it's typically younger athletes that typically get it. Could be a jumping sport, could be a sport like soccer or basketball, but typically it's running athletes that I've seen it in most often. Unlike stress fractures of, say, the metatarsals, the second, third, fourth metatarsals, long bones in the foot, the navicular is notoriously prone to not heal for two reasons. One, it has a very tenuous blood supply, and two, there's forces that tend to pull apart at the stress fracture site, making it harder to heal. So if you have pain in the arch of the foot along the bone, not so much on the sole of the foot, but on the bony aspect at the top of your arch, it's worth getting evaluated by an orthopedic surgeon. That may be x-rays, but more often an MRI of the foot to look for a navicular stress fracture. Because if you have one, very often the orthopedic surgeon is going to be very aggressive treating it. And that usually involves one of two things: strict non-weight bearing, be it in a cast or a walking boot, but no weight on it to try to get it to heal, or sometimes surgery to put one or two screws across it to compress that fracture and get it to heal. Sometimes they may try a period of non-weight bearing to try to get it to heal, but have a low threshold to proceed with surgical treatment to get it to heal. Because if that navicular doesn't heal, it can become a long-term problem with significant problems down the road. So orthopedic surgeons, especially sports medicine orthopedic surgeons and foot and ankle specialist orthopedic surgeons, typically have gotten much more aggressive about treating these. This is not the, hey, just stop running for a few weeks and it's going to be fine. These are much more serious injuries, and you have to be typically much more aggressive on the front end in terms of treatment. Now, if you have an orthopedic injury and you want to hear about other options other than surgery or cortisone shots, potentially I'd be able to help you. You can click the link in the description under this video, fill out the contact form to learn more about scheduling an appointment with me. Also, I'd love to hear your experience with your injury, so leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't offer you medical advice, but what I can do is I might answer your question in a future video like this one. Make sure you subscribe to my channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.